Why do you have a dry orgasm? Hi, I'm Stephanie Wolf, the leading sexual wellness expert here in Studio City, California at the Novus Center. And today we are going to discuss dry orgasm after having prostate surgery. I want to talk about both types of prostate surgeries. You have your radical prostatectomy, and then you have your partial prostatectomy or perhaps a TURP procedure. Why would you have any of these surgeries? Well, perhaps you've had prostate cancer, or maybe you've had an enlarged prostate. Both of these reasons are the reasons for having surgery. And I'm often asked by these patients, why am I experiencing a dry orgasm? And is there anything I can do about it? So today I want to talk about the radical prostatectomy. This is the removal of the entire prostate gland and the tissue surrounding that prostate gland. What I want you to remember is that your ejaculate fluid consists of fluid from your seminal vesicles, 60%, and 40% from your prostate gland. That makes up your 100% ejaculate fluid. So if you have a complete prostatectomy, you're removing not only that prostate gland, which is 40%, but you're also removing the seminal vesicles, which is 60%. So you are no longer making any type of fluid whatsoever. This is what we call a dry orgasm. Unfortunately, there's no way we can fix this. We can't get fluid to ever come out again. That's the bummer. Now, you do have some glands that sit within the urethra, and at times I've had men tell me that they'll have a little bit of fluid that comes out after ejaculating, but it's definitely not consistent with what they're used to. It's not the same color, it's not the same smell, and it's not the same look. And again, that's because it's coming from the glands of the urethra. And then there's something that's called retrograde ejaculation. Retrograde ejaculation usually happens in patients who have a partial prostatectomy or a TURP procedure. And again, this happens either because of prostate cancer or an enlarged prostate gland itself. And what happens during this is that both the seminal vesicles and the prostate gland are still there. So you are still making your fluid, but you're causing damage to a muscle that actually closes between the bladder and the urethra. I like to think of it as a door. The door doesn't shut anymore. And so what happens is when you're getting ready to ejaculate, the door doesn't say, oh, ejaculate fluid, you got to go down the urethra and empty out the penis. The door's just kind of hanging there. So then the ejaculate fluid goes into the bladder. You'll eventually urinate the ejaculate fluid out after having intercourse, but these men also will call this a dry orgasm. They'll reach orgasm, just nothing comes out, and then they'll urinate, and then that's when the ejaculate fluid comes out. Now, this can pose a problem for somebody who's looking for fertility or wants to start a family because, they need that ejaculate fluid. They need the sperm. So there are some ways to help with this, and therapists have suggested Kegel exercises or strengthening the pelvic floor so that you can get that muscle tone back to hopefully close that door. But unfortunately, having a dry orgasm really is no cure to it. And I want you to understand that you're not alone, and there are other men out there who are saddened by this. So if you're saddened by this, we understand here at the Novus Center. So I really wanted just to do this video just so you guys had an understanding about exactly what a dry orgasm is and why it's happening to you. So if you have any other questions or concerns, please leave them in the comments below or give us a call here at the Novus Center.